Thank you very much, Dr. Wall. I wanted to start by thanking the Center for Latin American Studies, the University of Pittsburgh, and all the dignitaries from the Office of the Mayor who are here. It is a pleasure and an honor to speak to you today. We're, as Dr. DeWalt mentioned, celebrating 10 years of our program. And Salud Para Niños stands for Students, Residents, Faculty, and Latinos United Against Health Disparities, and that's one of our objectives. When we were creating our clinic at the same time, the Birmingham Clinic was serving Hispanic adults, so both Salud and Salud Para Niños are celebrating this year 10 years of its creation. Today we're going to quickly review some demographics of the Latino community in our region, in the country. We're going to talk about healthcare access barriers, how if we don't address these barriers, they become disparities, and we're going to be talking about our program. This is something that you guys hear in the news, and it's from the census of 2010. There are 50.5 million Latinos in the US, 16.3% of the population. And for those of us who work with children, this is very important because the Latino population tend to be a younger population. Here we have numbers of population, here we have ages, and 1/3 of the Latino population is under the age of 18 versus 1/4 of the general population. And in particular in Allegheny County and areas like ours, probably this might be even close to 1/5. So bottom line, the Latino population tend to be a younger population. When we narrow to the state, there has been an increase, an important increase since 2000 to 2010. Now we're about 5.7% of the population. Not close to what I just showed you at the national level, but nonetheless important. And I'd also like to show this slide, and I know there are some students here who actually, I want to thank their faculty for deciding to meet in today here as a class. We use this slide to present that Latinos is an ethnicity, not a race. So you can be Latino, white, you can be Latino, African American, etc. And again, when we continue narrowing, this is our region, southwestern Pennsylvania, and these are the 7 counties that I encountered. And over the last 10 years, there has been an important increase of about 70% of the population. So we're talking about 30,000 Latinos in southwestern Pennsylvania, and 1/3 of them being children, about 10,000. This increase of 70% was very important. When the Post Gazette presented this data about a year ago from the census of 2010, they refer as a modest growth. And of course, it's modest when you compare to other areas of the country, Philadelphia, Texas, California. But nonetheless, if you think that in our region for years we have been talking about the possibility that we're losing population, thinking that we're growing in 70% is a very important number. The important piece is that when we created the program 10 years ago, when I presented this program to the hospital, a lot of voices said, well, are you going to have enough patients to have this clinic up and running? And as a matter of fact, the first year was a pilot project, but these numbers are really important, 10,000 to 30,000. This is another statistic that we gathered from the Allegheny County Health Department. It talks about newborns to Latino mothers. We get it 2 years behind, so this year, this summer, we get the statistics from 2010, and there were close to 250 babies born to Latino mothers in 2010. There was an increase of 202% since 1989 to 2010. You think about this number, 250 babies born to Latino mothers, it means that almost every day there is a baby born in Allegheny County to a Latino mother. And we're not talking even when you have Latino fathers with non-Latino mothers. Some characteristics of the population, in the US, 70% of the Latinos are citizens, 89% are children born in the US, 52% are second generation, 37% are third generation. 77% speak Spanish, 62% also speak English, 50% are homeowners, 19.5 million vote in the last election, and then there are 25 million who are eligible to vote. So hopefully in this new common election we have all of those 25 million voting. In particular, in southwestern Pennsylvania, we have some specific characteristics and unique characteristics of the community. Up until 2000, Latinos who were coming to our region came from countries from South and Central America, Peru, Colombia, Venezuela, Argentina. Contrary to what you see at the rest of the country, the majority of Latinos in the rest of the country belong to 3 main groups: Mexican Americans, Puerto Rican Americans, and Cuban Americans. By 2010, this has changed, and the majority of Latinos in our area are Mexican Americans, which is behaving like the rest of the country, certain areas of the rest of the country, but it's very interesting because southwestern Pennsylvania is not behaving like the rest of the state. The majority of Latinos in Harrisburg, in Philadelphia, Eastern Pennsylvania, Central Pennsylvania, are Puerto Rican Americans. We had the opportunity to go and present in summits, health summits at the governor's office, and they get surprised when they hear that the majority of Latinos in southwestern Pennsylvania are Mexican Americans. The Very interesting data, and I'm quoting here the census, but also I'm quoting here Dr. Documed's thesis. There is, up until 2000, there was a disproportion between education and income. Latinos in our region had more years of education compared to the general population. However, those many years of education, they didn't represent income, and those incomes were actually similar to other Latino populations around the country, below the median. So up until 2000, we had a population that was highly educated with low income. This might have changed up until 2010. We haven't seen that data yet. And then the other unique characteristic of our population is that there is a lack of barrio or neighborhood. When you go to other parts of the country, you go to New York, you see Latinos tend to live in the same area, Queens. You go to Miami, you see Little Havana. Here in Pittsburgh, what we have seen, and these are statistics from two of my medical students that now are physicians, Julian Escobar and Arturo Torres, by the way. Julian Escobar was the one who created the adult program at Birmingham in 2002, again celebrating 10 years. What they did at that time is that they plotted our patients in their zip codes, and these are in brown. This is the city of Pittsburgh. You can tell they live all over the place. And in blue, we have the places where we serve our population. So main Children's Hospital of Pittsburgh, Lawrenceville, our clinic here in Oakland, and then the south side where we go once a day, the Birmingham clinic. So there is not an area where people get together and this contributes to invisibility. Other factors that contribute to invisibility I have mentioned already: country of origin, and the fact that the percentage-wise is not that big. In the city of Pittsburgh, we're talking about maybe 2.5% in the Western area. In Allegheny County, anywhere between 1 to 2%. So when you look at those percentages, are not that big compared to the rest of the state. On the other hand, when you look at raw numbers, 30,000 people, 10,000 children, those are very important numbers. Okay, so why do we care about this population? Well, there are some barriers that can affect access to healthcare. Some of them language. 1 in 15 children ages 5 to 17 have limited English, and this is not only about children who grow in homes where Spanish is the main language. There's about something like 144 languages in this country. That's what the census used in 2010. Cultural aspects, insurance, socioeconomic status, transportation, immigration, and other. This has been well documented by a well-known researcher who used to be in Harvard. Now he's in Texas. Dr. Flores published this in the New England Journal of Medicine. In the same Dr. Flores, in another article, tried to group these different barriers to healthcare access and how can they affect by system, by communication, patient, and provider. I'm going to just go quickly to some disparities. If we don't address those barriers, then we result in disparities. So 30% of Latino children in the country have no usual source of care, 22% uninsured, 2% of preschool children hospitalized for asthma are prescribed with routine preventive medication. This is very low. You know, when kids come to the hospital with asthma, one of the things that we need to think is prescribing them with prophylactic medication so they're going to get ill. These numbers, even for the young population, are very low. 11% of Latinos don't seek care because of lack of cultural competent care, and Latino families are less than satisfied with their health care. So quickly again, I'm going to go through some disparities. I have focused in 4 of them, the ones that we try to address through our program: education, immunizations, obesity, and car safety. In terms of education, 22% of Latino youth drop out of high school, 50% of Latino fourth graders read below basic level. Latinos are 20% less likely to be enrolled in early education. Latino parents are less than half as likely to read to their children. And Latino families have 1/3 of the books that white families have. And you know, this is not surprising because when we immigrate, the last thing that goes in your suitcases are the books. Latino toddlers begin to lag behind white middle-class children in vocabulary, listening, and problem solving really early. In terms of immunization, this is something that is called the U.S. National Immunization Survey. It's done by the CDC. They call families and they ask them if their children ages 19 to 35 months have all these immunizations. And back in the 90s, we have big disparities, about 5 points % between white and Latinos and white and African Americans. The good news is that with time, these statistics has improved, and when you look at the end, you know, by 2008, this disparity has decreased. This is a result of 2 things. The Vaccine for Children program that was implemented during the Clinton administration, and the other program that has been very successful in addressing this is the state insurance chip in our state. Nonetheless, we should be here at 100%. There is no reason why everybody, not only Latinos, but also African Americans, but also white kids, shouldn't be 100% on immunizations. And if we don't do these immunizations and we're not 100% rate, then what we have is illnesses that are preventable by immunization. So one that is really important right now, because our country is going to an epidemic, is Pertussis, whooping cough. In 2000, there were 17 infant deaths from Pertussis. All were US born, and there was a large proportion on Latino children who died from this illness. An illness, again, that was preventable. Between 1990 and 1999, there was a disproportionate number of pertussis deaths among Latino infants. And most recently in 2010, and this epidemic actually continues up until now, 2012, just in 2010 there were 21,000 cases, 10 infant deaths in California, the majority Latino, 26 total in the US. This is something that can be prevented not only by giving the immunizations to the kids, but also to making sure that teenager siblings and teenager parents get the immunizations. And as a matter of fact, there was a publication in pediatrics last week that was talking that maybe the vaccine that we're using is also responsible for this because it doesn't have the same immunity, immunity. So maybe next year what we're going to see is that they're recommending vaccines for adults and for teenagers every 5 years against pertussis. Another illness, and this is also close to our home, measles. You might remember that a couple of years ago we had an epidemic of measles in Pennsylvania and in Pittsburgh, 40% of all the cases in California until 1989 and 1990 were among Latino children, highest proportion of any subgroup, and Latino preschoolers are 9.6 times more likely to contact measles. What happened here in Pittsburgh, there were only total 6 cases. Out of the 6 cases, there was only one Latino child, and that child actually was not supposed to be immunized because he was under the age of 1. When talking to the infectious specialists, that's something that they assume is a risk. You don't give this vaccine until they are 1 year old, so there might be some cases below. But what it was really good news is that despite the fact that one Latino kid contracted the illness, no other kids in the Latino community got it. And the county, the health department was very proactive in addressing this issue. I remember being in contact right away. This kid was to several places, the lending library, the toy lending library, to make sure that all the kids address this issue with the pediatricians if they were immunized. In terms of obesity, this is another epidemic that we're facing. 12 million of children are overweight in our country. 30% of Latino children are overweight versus 25%. And Latino adolescents born in the U.S. to immigrant parents are more than twice as likely to be overweight as foreign born adolescents who move to the U.S. So it talks about not only that there might be some genetic component, but also some environmental component. Let's talk finally about Latino children and car safety. There's an increased risk profile and non-fatal injuries, 60% higher death rate per billion vehicles per mile travel among ages children 5 to 12. There is, and we know this, there is a increased use of car safety devices, not only car seats but also seat belts among Latinos. This has to do with the fact that there is no country in the world, as a matter of fact, but even of course when you compare to Latin America, that has the type of regulations that we have in this country and in Pennsylvania. Pennsylvania is one of the states that has the best regulations for car safety, even compared to our neighbors, Ohio and West Virginia. And when we compare those legislations to Latin America, there is no enforcement of the use of seat belt, there is no enforcement of the use of car seats. Might have to do with resources, it's expensive, and some people postulate that it has to do with velocity and speed where people drive in Latin American countries. I have a case at the end that I would show that even at slow rates, speeds, you should always wear your seat belt. You should always make sure that your kids are in their car seats. So finally, let's talk about our program. These were the goals when we created the program. The idea was to reduce health disparities, combat social isolation. As I mentioned, our population is prone to isolation, given their invisibility. We partner with community agencies, we permit systematic data collection, and we create an ideal environment for developmental screening. I wear a couple of hats. One of them I'm a general pediatrician, but I also am by specialty training a developmental behavioral pediatrician, so that was something that was very close to my heart. We created the clinic. It was the first pediatric bilingual bicultural competent clinic in Western Pennsylvania. At the same time, the first adult clinic for Latino adults was created in Pittsburgh. The clinic was created 10 years ago as a medical home for Latino children. When you look at this term, this is something that is kind of like a hot topic. Came from the American Academy of Pediatrics, now it's being embraced by different societies and different specialties. The idea is that you don't only go to a doctor when you're sick, you go to a doctor for preventive care, and that doctor not only provides you with a quick checkup or a quick visit or address your concerns, but also should be able to link you with all other specialists and all other services in the community that you need to grow up healthy. So that's what we do. We focus on the medical home model. We provide traditional primary care service in 3 locations: at Children's Hospital of Pittsburgh Primary Care Center here in Oakland, at the Birmingham Clinic in the South Side, and through our mobile unit. And the idea is to increase prevention and empower the community to access its own health. We have 3 clinics here in Oakland: Tuesday mornings, Thursday evenings, and Friday mornings. It's staffed by Spanish-speaking physicians, nurses, and volunteers. We go once a month to the South Side, to the Birmingham Clinic. This is the Birmingham Clinic. The building belongs to the Salvation Army. This is our new facilities. There we partner with the adult initiative, Salud, which was a medical student initiative created in 2002 via the program for underserved populations, and we thank for their support, and other community support that we have received of course, the University of Pittsburgh, the Salvation Army, and the American Corps members. This is our mobile unit, belongs to Children's Hospital of Pittsburgh, was donated by one of my charities. It provides extra space, physical exam rooms, and it also helps us to track medical records. Every time a child is seen in the mobile unit, they have a medical chart there, a medical history there. Every time that they are seen in the Birmingham clinic with our mobile unit, we created 3 medical charts. One is at Birmingham, in case they show up at a later time. One goes in the care mobile, in case they stop the mobile unit in another time, and goes automatically to Children's. They have automatically a medical record created at Children's Hospital of Pittsburgh. Since we started, we were the first specialty order in internal medicine at the Birmingham clinic, and we have been able to assure that other specialties come to the free clinic, and now these are also specialties that we provide for free. We have weight management, we have dermatology, we have child psychiatry, we have adult psychiatry. Last Saturday we had an encounter with more than 250 women about depression. Several of our psychiatrists who volunteered their time came to this encounter. Developmental behavioral pediatrics, adolescent medicine, reproductive health, and neurology. We co-organize community fairs, and Dr. DeWall mentioned la Feria del Servicio a la Comunidad that Dr. Document created about 10 years ago. By the way, all of you are invited. William P. Jr. this Sunday at noon. There's going to be Latino food, there's going to be Zumba, it's going to be a fun event. In these programs, we promote healthy habits, we distribute health information, we give presentations about child care and parental topics. I believe this picture is from probably 2003-2004, one of our first fairs. Tina Ramirez was at that time our nurse. She's now moved to Texas. Dr. Roberto Ortiz is a triple board certified child psychiatrist. He works in pediatrics as well. He's still in the area. We have also created other programs. We created these CPR classes. We have done 3 of these events. In the first one, we have about 50 adults training for CPR. And the impact of these programs sometimes is hard to evaluate. It was definitely very moving to see everybody kneeling down, doing chest compressions, learning how to do the CPR. But when you hear the stories later on, how this affects somebody's care is when you get motivated and you see, well, this definitely makes a difference. 2 weeks after this first event, a family came to my clinic and almost crying. The mom said, I cannot thank you enough for what you guys did with the CPR class. We went to visit our family in Miami. While being in Miami, my child had some kind of spell, maybe a seizure. Went blue, I was not breathing. I had to call 911. I wouldn't have known how to call 911 if it wouldn't be for the CPR class. I have to give some rescue breaths. Thanks to that CPR class, my child is alive. So those are the things that motivate us to continue on. As I mentioned to you, one of the problems that we have is obesity and sedentarism. We tend to hibernate in the winter. We don't move, so we want to make sure that families know that it's not that difficult to be active. And here in the States we're very organized, and we love to have leagues and minor leagues and soccer leagues, and that's great. But not every family can afford to enroll their kids in those programs. Not every family has the time to get involved in these programs. So we created something that's called Fútbol para Niños, Fútbol para la Familia, soccer for the children, soccer for the family. And the idea is that they come and in a very informal way, we all play together. The pediatrician, the parents, the kids. I always love to show this slide if you see his mom is playing with the pills. But hopefully the message that the families are getting is that in order to be active, in order to play, you just need a ball, some green space, and the desire to do it. By the way, this program has been, in the implementation of this program has been fundamental, the participation of the soccer team of the University of Pittsburgh. They have come to several of these events. They actually invite the kids one time to watch Pitt playing Notre Dame. I'm not going to mention the score. But they have been very kind, and they actually want one opportunity to invite us to play. We have about 150 kids playing in the main new soccer stadium of the University of Pittsburgh. We also have partnered with family support centers. When we started in 2005, Children's Hospital of Pittsburgh had one of the family support centers here in South Oakland. They are called Family Care Connections, unfortunately closed in 2005. We approached the county, we approached Mark Turner in 2007. We proposed the idea of creating another family support center that addressed the issues for Latinos. In all honesty, at that time we were not thinking about doing it exclusively for Latinos. We were thinking just another family support center, ideally in Oakland or in a central area. The county was very generous and created actually the first Latino family support center that now sits across the Birmingham Clinic in the south side. We also have a literacy program, and believe me, I'm the first person who said that if you're going to live in this country, you do need to speak English. But I also said that this is what you get after 4 years. So it's not easy, it's not perfect, and for these families who, when they first arrive, they need the service in Spanish. Starting at 6 months, every child comes to our clinic. After their shots, they get bilingual books. And these books we hope motivate kids to start reading, and hopefully we'll start to address those disparities that I showed you earlier about education, but also hopefully these books also encourage parents to learn their English. Here we have our literacy program director, Miriam Davis, reading the story in English to the families, and one of our doctors, Isabella Angeletti, reading the story to the kids in Spanish and to the family. About a year and a half ago, we partnered with the Pittsburgh Promise. Please raise your hands if you don't know what the Pittsburgh Promise is. Okay, so the Pittsburgh Promise is a wonderful program that the city of Pittsburgh has. And the promise consists that the city of Pittsburgh is going to improve the quality of the schools of the city of Pittsburgh, but also the promise goes to the kids. And the promise is that the kids stay in school since early age, have only 10% of less missing attendance, but also keep a grade point average of 2.5. They will get a scholarship to go to college. They get about $40,000, anywhere between $30,000 to $40,000 to go to college. So, this program has been in place since 2008. Again, about a year and a half ago, we approached the Pittsburgh Promise and said, this program is great, and we know the kids are learning about this program because the school is telling them about them. There is something that is called the pathway to the promise, and they get report cards, and they tell them, you're on track on the Pittsburgh Promise, and make sure you keep your grade, make sure you don't miss school. By the way, it's not competitive, so everybody gets it. If you do those two simple things, GPA 2.5 and don't miss school, everybody gets it. There are commercials on TV that parents were saying, I got 5 times this scholarship because I have 5 kids, so they can get it. So kids knew about it. The problem that we found out is that the parents didn't know about this, because the parents sometimes didn't speak English. So what we did with the Pittsburgh Promise is that we started collaborating, and we developed materials in Spanish. We did some sessions at the church where the community came. And I'm going to show this in the results, but we congratulate and make a big deal of the kids who are already in the university. We have some kids in the university from this program, some Latino kids, and I'll tell you some stories in a minute. We have translated materials both locally and at the state level. This is the book that all moms, the books that all moms get in McGee when they deliver a newborn baby, the guide of care for the newborn. And this is some kind of material that the state has developed and where we have participated to translate to promote immunizations. This is another type of program another type of material that we have developed with the American Academy of Pediatrics Pennsylvania chapter to promote immunizations. And I love to show this one, and for the students, this shows the importance of not only translating the materials, but also to be cultural competent. So when you're talking about the mainstream cultures, obviously, the Phillips, the Steelers, the Eagles, hopefully our Pirates, it's a big deal for the kids. When we're talking about Latino culture, make sure you mention soccer, you mention quinceañera. Okay, we have a newspaper, a local newspaper, it's called La Jornada Latina. It's published by a Cincinnati company, and in the newspaper we have a monthly column where we talk about health issues. We advertise our clinics, and here we're talking about our program, Salud Para Niños. We have a Spanish phone line, and we were probably the first Spanish phone line locally. Before there were other call centers at the national level, PNC, etc., but we were probably the first Spanish line. And by the way, now we have paid staff who answer this Spanish line, but at the beginning, as a matter of fact, these 2 students were Center for Latin American students who volunteered their time, and that way they help us to run the Spanish phone line. And then here we have the car seat checks. We go to the community, we do these events twice a year, where we promote the use of car seats and seat belts. And I like this picture because I like to show that when we do one thing, we try to do everything. We try to do immunization clinics, we try to do literacy programs, so the idea is that everything is being addressed. So let me share with you some results. Since 2002, of the beginning of the program up until 2012, we have increased our number of patients in our clinic up to 900 patients. A couple of years ago, 2 of my students, also Center for Latin American students, went in looking to our immunization rates, and the good news is that our kids, Latino kids, were doing at the pair of other kids who were not Latino. That's the good news. The not good news is that everybody should be 100%. So we still need to work on this, make sure that everybody gets their shots. We are providing now around 1,000 visits a year. More than 100 children have been assisted in obtaining health insurance, and we partner with a local organization, the Consumer Health Coalition. We have, as I showed before, several specialty clinics in the free clinic. This is actually, by the way, how it looks inside the model unit. This is the waiting room of the model unit. And here is the Pittsburgh Promise, La Promesa. This is one of the materials that we developed. And as part of the results, I'm happy to share that we have several kids who are getting the scholarship. Right now we have 8 kids who are in the Pittsburgh Promise. And one of the stories is really moving. We have this young girl who is first generation in their family who graduated from high school. and actually first generation to go to college. She now attends Carleton University. He wants to be a nurse, and he has been a wonderful role model for their siblings. And she's getting the Pittsburgh Promise. And I wouldn't do fairness if I don't mention Hector. He's another of our patients. So we are making a difference in our community. And thanks to the city of Pittsburgh, thanks to the Pittsburgh School District, these kids are going to grow up to give back to the community. That's my goal. My goal is not only that these kids are healthy, but that these kids grow up, become adults who give back to the community to make this community a better community. Since the summer of 2003, we have organized 70 car seat checks. The last one was 2 Sundays ago. We have the next one at the end of the month. We have checked 451 car seats, and we have replaced at no cost to the families 221 car seats. A lot of these car seats that the family brings, they are not appropriate. They have gotten in Goodwill, in second-hand stores. Sometimes the car seat, it might be okay, but there is not a good match between the car and the child and the car seat. So we need to make sure that they are appropriately restrained, and if we need to, replace them. And a couple of years ago, we had for the first time our first bilingual bicultural certified tech. Not surprising, another class student who actually finished college at Pitt and moved on to receive offers to go to medical school from Johns Hopkins, Brown, and very reputable universities. I wanted to keep her in Pitt, unfortunately she moved on. And when we're talking about prevention, sometimes it's hard to show that what we do makes a difference. But I always bring this story, and it's about a Mexican family that on Sunday, December 18, 2005, was going from Oakland to the waterfront for Christmas shopping. And this is the part where I tell you about how speed makes a difference. Even if you're driving slow, please always wear your seat belts. Always make sure your kids are in car seats. So this family is driving about 35 miles an hour, not that fast. In the minivan of the Mexican family, there are 2 adults and 3 kids ages 5, 6, and 10 months old. And this family has come to several of our car seat checks, and they are wearing their seat belts, they are in their car seats, they are properly restrained. I even remember the mother coming pregnant saying, I want to make sure that my baby to be born has a car seat. And that was the 10-month-old then. So they are driving through Shinley Park, 35 miles an hour, calm, no problem. There is this white car who is running away from the police. The driver and the passenger, they are not wearing seat belts. The passenger got killed in this accident. The driver was taken to Presbyterian Hospital to the intensive care unit. And from there, discharged to jail, charged with homicide. Guess who paid them and the admission to the hospital for this family? We all did, taxpayers. And then in the minivan, which actually the picture doesn't make fairness, the minivan was a total loss. Nobody got an injury. No, they didn't get scratched, they didn't get a laceration. So in conclusion, there is a need for cultural and linguistically competent healthcare for Latino children. A lot of the time there is no need for new resource or service. People get surprised when they ask me, what is your budget? And I said, my budget is 0. Because most of the things that we do in volunteering time. And most of the things that we do is we just link with programs that exist. So it was impossible for me to dream about creating a scholarship for kids to go to college, but we link and we partner with the Pittsburgh Promise. We partner with the people who are already running the car seat checks. We partner with the people who are doing the leadership program. Again, most of the services are in place, they need to be connected, and as I show, prevention pays. In the future, we want to continue working in increased access, healthcare insurance. Still is an issue. People like to think that because in Pennsylvania we have medical assistance, we have CHIP, all kids should be covered. No, that's why we have the free clinic, and the free clinic is busy. We want to improve systematic data collection, we want to increase and improve developmental screening, and we want to continue working in prevention and promotion and maybe using research. And with that, I'm going to stop, and I'm going to thank you for your attention.